today's news, President takes direct control of thalassemia care efforts. President assures all applicants on waiting list will complete Hajj this year. And Stelco MD denies allegations regarding purchase of apartment.
Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to News. I'm Yusuf bin Muhammad. President Dr. Mohammed Moise has announced that everyone on the Hajj Corporation's waiting list will be able to perform Hajj this year. In a post on X on Sunday night, the President highlighted that this marks the first time in years that all waitlisted pilgrims will be accommodated within their expected year of travel. The announcement follows the Ministry of Islamic Affairs decision last year to centralize Hajj arrangements, making the Hajj Corporation the sole entity responsible for organizing pilgrimages and discontinuing quota allocations to private companies. The change aims to resolve frustrations from those who previously paid the Hajj Corporation but were unable to travel due to the fragmented quota system across multiple providers. The President amended the Hajj policy on January 5, 2025, replacing the Pay First, Go First system with a framework prioritizing first-time pilgrims. The revised guidelines, published on March 18, 2025, allocate a portion of the annual Hajj quota to individuals over 65 who have not yet performed Hajj. For those aged 75 and above, an assistant may be arranged based on health conditions, with preference given to family members who have not performed Hajj. If no eligible family member is available, an assistant who has previously performed Hajj may be assigned, provided no first-time pilgrims are available to accompany them. Additionally, individuals who have previously performed Hajj will be eligible for another pilgrimage only after 5 Hijri years. According to the Hajj Corporation, 9,115 people are currently in the queue, including 7,543 under 65, 1,461 between 65 and 75, and 111 over 75. Amongst them, 8,623 are first-time applicants, comprising 7,150 under 65, 1,370 between 65 and 75, and 103 over 75. President Dr. Mohammed Moise takes direct control of efforts to improve thalassemia care in the country following a visit to the National Thalassemia Center on Sunday.
His intervention follows years of frustration from patients and families over deteriorating service quality and operational shortcomings at the facility. President Dr. Moise's visit is the first time in recent history that a sitting president has personally examined the center and engaged directly with patients, families, and staff, signaling a decisive shift in the government's approach to thalassemia care. During his tour, the president met with patients undergoing blood transfusions and spoke with their families and caregivers. He inspected various departments to assess service gaps and later visited the Orangia building in Hurumale, where the center is scheduled to be relocated. In response to concerns raised by patients and families, he announced that all reforms would be carried out under his direct supervision and assured that financial constraints would not hinder the necessary improvements. One of the most pressing issues identified was the absence of a Director General at the center since 2017. The President instructed authorities to expedite the appointment process and ensure stronger leadership to drive these much-needed reforms. He also ordered an increase in human resources, including the recruitment of additional nurses and laboratory technicians. This expansion aims to extend the center's working hours to better accommodate patients, bringing it in line with major hospitals such as Indira Gandhi Memorial Hospital. The planned relocation to Hurumale was another key focus of discussions. President Dr. Moise highlighted the benefits of the new facility, which will offer significantly more space and expanded resources. To address accessibility concerns, he confirmed that a designated bus stop would be established near the new center, along with other logistical measures to ensure patients can access care without additional burdens. The government has already begun implementing measures to enhance service quality following years of advocacy from patient groups and families. The President emphasized that the relocation process must be carried out in consultation with patients to prevent unnecessary disruptions to their treatment. For over a decade, advocacy groups and families have pushed for improvements, often with little progress. Despite repeated pleas, meaningful reforms remained out of reach, leaving many patients struggling with inconsistent care and inadequate resources. Now, with the President stepping in directly, his administration's commitment to reform signals a renewed urgency, one that patients and their families hope will finally bring tangible improvements to the country's thalassemia care system.
In an exclusive statement to MMTV, Health Minister Abdullah Nazim Ibrahim confirmed that laboratory services will now be available across all islands in the Maldives. The latest establishment of point-of-care machines across 76 islands marks a significant milestone in expanding healthcare access, bringing laboratory services to communities that previously lacked such facilities. This initiative reflects President Dr. Mohamed Moizu's commitment to strengthening healthcare services nationwide, with a particular focus on areas beyond Male. The development of healthcare infrastructure, particularly in remote areas, has been a key priority for the administration. During his post-election visits to the islands, President Dr. Moise received consistent feedback from residents regarding the inadequate quality of healthcare services. Recognizing this as a pressing concern, the Ministry of Health has launched a large-scale project to improve healthcare facilities across the atolls. While services have already resumed in many locations, further expansion is planned. Additional point-of-care machines will be introduced to enhance existing laboratory services, and new healthcare facilities will be developed to support the construction of laboratory buildings. As part of this initiative, the government has already begun several projects to build and upgrade healthcare facilities. Earlier this month, contracts were awarded for the construction of health centers on 9 islands, and preparations are underway for the second phase of the development, with additional projects expected to be awarded by the end of the month. These measures directly tackle one of the biggest challenges in expanding rural healthcare services, the shortage of proper infrastructure. By establishing new healthcare facilities and equipping them with essential medical and laboratory equipment, the government aims to significantly enhance both the quality and accessibility of healthcare in remote areas. After a short break.
Ini kanam emme bege bimeshan ero afta gahan nasiwari komme nasiwari enha sofia mi homa ken ramlomo ge nila kuriya da promotion adibuna 200 rupiya mati komme vyapareka kasaage bodit inam devare 520 rupiya 500 rupiya everyone inam haddiha pass as coffee ongara bonnan pili sikdu istihare kemagena waake unde ke February bihin April 20
Yusan Fiara roda hadiya marangalu.
Yusan Fiara roda hadiya promotion.
Welcome back. The Managing Director of State Electric Company Limited, Stelco, Hussein Fahmi, has denied allegations circulating on social media that he purchased an expensive apartment after assuming office, calling the claims baseless and politically motivated. In a post on X on Sunday night, Fahmi dismissed the rumor that he had bought an apartment worth over 8.5 million rupiah after taking office. He describes the accusation as a deliberate fabrication aimed at defaming him for political purposes. Clarifying the matter, Fahmi stated that the apartment in question was purchased years ago during former President Abdullah Yamin Abdul Gayoom's administration, and that he has been making payments on it since that time. He urged those spreading false claims to refrain from damaging people's reputations, regardless of political motives. Fahmi added that while he welcomes constructive criticism regarding his role at Stelco, even if politically motivated, baseless accusations should not be used as a tool to mislead the public. Noel Gregor Patterson-Jones has stepped down as the Chief Executive Officer CEO of the Development Bank of Maldives, DBM, as confirmed by the Privatization and Corporatization Board, PCB. His resignation comes at a critical juncture, with the bank still in its early stages of operation after being established in May 2024. Patterson-Jones, who took on the role in August 2024, was tasked with the leading of bank through its initial phase. DBM was set up to be a key institution in supporting national infrastructure projects, assisting businesses and driving economic growth in the country. As a government-owned entity, DBM was created to address challenges in financing infrastructure projects and to promote sustainable economic and social development, aligned with national policies. The bank's main objectives included raising funds for infrastructure through syndication finance and boosting the retention of foreign currency in the country's banking system. Minister of Economic Development and Trade Mohammed Saeed had also previously emphasized that the bank would play a crucial role in securing financing for public sector investment projects PSIP and ensuring long-term sustainable growth for the nation. Thank you for watching MM News. I'm Yusuf bin Mohammed and have a great day.